Okay, I'm looking at my orders and I see Miss Doe has an order for a Foley catheter. So I'm going to grab all of my supplies from the supply room and go to her room. Knock, knock, knock. Hi, Mrs. Doe. This would be the kid. My name is Kayla. I'm going to be your nurse today. I'm going to shut the door, provide hand hygiene. Can you tell me your name and date of birth?
Tammy Zimmerman, June 16, 2003.
Thank you. Ms. Zimmerman, I have an order from the doctor here to place a Foley catheter. What that is a catheter that goes up through your urethra into your bladder to help empty your bladder for that urinary retention you're having. So we're going to be doing that. To start off, I'm just going to start off with some peri-care. So I'm going to make sure the bed is at appropriate working height. I'm going to put some clean gloves on. And is it okay if I go ahead and lower this sheet down? Thank you. I'm just going to make sure your legs are in position. And then I have my clean wash basin here with soap and water. And I'm just going to go down the side, fold, go down the other side, fold, and go down the center. Then I'm going to take my gloves off and perform hand hygiene. Next, I'm going to get my kit ready. My kit is intact and it is not expired. I am going to use this as a trash can. I'm going to open this away from me first. And this is already in my kit. And then I'm also going to put clean gloves on just while I place this drape down. Shiny side down. If you can lift your hips for me. Thank you for that. Now I'm going to take those gloves off, hand hygiene, and I am going to do my sterile gloves. I'm going to open that up. Non-dominant hand first. Okay, then I'm going to place your drape. It'd be a clean drape, a new drape, not a well-used drape. We're just going to place that down. And now I'm going to examine the rest of my kit. Got my lube here. Put you right there. Got my iodine, sitting in my iodine. Then I'm going to attach, and it has 10 mLs in it. I'm going to keep note of that for later. And now that that is ready, I am going to commit my hand, and I'm going to do one swab down the side farthest away from me. Going to do another swab closest to me. And then I'm going to do one swab down the center. Then I am going to get dip it in my lube. And I'm going to insert until I get urine return. Once I get return, I am going to advance a little bit more. I'm going to use my non-dominant hand, and I am going to inflate my balloon. And I'm just going to tug, make sure that it stays. I'm going to put my sat lock on the inside of my leg for a female, and I would hang this on the side of the bed and make sure it is timed and dated and initialed. Then I'm going to clean up my patient, take my gloves off. I'm going to perform hand hygiene. I'm going to get Miss Zimmerman back up and ready to go. Miss Zimmerman, are you doing okay?
Yeah.
Do you need anything else right now?
No, I'm okay.
Okay, I'm going to lower your bed back down, and here's your call light. If you need anything, just give me a call.
Okay, thank you.
Okay, then I'm going to perform hand hygiene, clean up the rest of my trash, and go document. I'm going to document the time and date of the procedure, the reason for the procedure, and the size catheter that I used. I'm going to note how much urine output I had, color, clarity, odor, and amount. I am also going to document that I used 10 mLs of normal saline to inflate the balloon and that she tolerated the procedure well.